Assalamu alaikum. This is Dr. Mary Ibrahim again with our final guest for the Thought Leader series for Dubai Healthcare City Authority's participation in Arab Health. My next guest needs no introduction. He is extremely active on the media to spread awareness about the importance of child and adolescent mental health. Dr. Ammar Banna, thank you so much for joining us. Dr. Ammar is a Canadian-trained consultant child and adolescent psychiatrist and the head of the Child and Adolescent Mental Health Center of Excellence at Algeria Children's Specialty Hospital in Dubai. He is the founding president of the Emirates Society for Child and Adolescent Mental Health, the national representative society for this field in the United Arab Emirates, under the Emirates Medical Association. He is an assistant professor in psychiatry at Mohammed bin Rashid University of Medicine and Health Sciences in Dubai. Dr. Banna completed his psychiatry residency and child and adolescent psychiatry training at McGill University in Canada. He then joined the Toronto Hospital for Sick Children as a fellow in pediatric neuropsychiatry. Dr. Banna is a fellow of the Royal College of Physicians and Surgeons of Canada and an international fellow of the American Psychiatric Association. He also holds a master's degree in healthcare leadership from McGill University. Dr. Banna has peer-reviewed research publications and is a recipient of the Research Grant Awards as the principal investigator, including the Dubai Harvard Center for Global Healthcare Delivery Research Award from Al Jalila Foundation. His current research focus is on neuropsychiatry disorders in UAE, including autism spectrum disorder and innovative models for healthcare delivery. He is the co-principal investigator for the research project that received the first cycle funding from SWORD, or Sanduq Al-Watan Research Award, entitled Application of Machine Intelligence to Quantify Neuronal Pathogenicity and Phenotypic Progression for Mutations in Autism Spectrum Disorders. That's a mouthful. Thank you, Dr. Banna, for joining us so much.
Thank you for your
you're extremely busy. You wear many hats. So we are very, very grateful.
It's my pleasure to be here, and thank you for your kind introduction.
Thank you, Doctor. You're here presenting Algeria Children's Hospital. Can you tell the audience more about Algeria Children's Hospital in the DHCC?
Yeah, so Algeria Children's Hospital is, in fact, the first specialized pediatric hospital in the UAE.
Yes.
So the opening of Algeria Children's in November of 2016 actually was an important milestone in the history of healthcare in the UAE.
Great.
And since its opening, Algeria Children's actually is located in within the DHCA premise, and since its opening, Algeria Children's opened a lot of important subspecialty programs within pediatrics.
Yes.
that existed for the first time in the country since the opening of the hospital.
Yes, in addition to research, I also manage education, and like you said, even these subspecialties are associated with rotations and training programs. Very, very busy teams over there.
Yeah, just quickly, Algeria Children's is as a philosophy is based on three foundational pillars.
Yes.
One is excellence in clinical care,
yes,
and then research and education. This is why, as you pointed out correctly, a lot of our clinical programs, aim for very high standard of care.
Yes.
In addition, they're affiliated with an educational program as well as research. For instance, we have a pediatric subspecialty program at Algeria Children's,
yes,
in collaboration with Mohammed bin Rashid University, MBRU, and the Saudi Commission for Health Sciences. And we have the first subspecialty training program in child and adolescent psychiatry.
Yes.
Actually, the first in the UAE and among the first within GCC. It's a 2-year program, post-psychiatry training. It is also in collaboration with Mohammed bin Rashid University for Health Sciences,
yes,
and the Saudi Commission. And we recently actually had our first graduates. So we already have 2 graduates, child and adolescent psychiatry.
That's wonderful. That segues immediately nicely into the next question about the importance of raising awareness about how critical child and adolescent psychiatry is in the UAE and for everyone, really.
Yes, so raising awareness is really important because child and adolescent psychiatry is or child and adolescent mental health overall is really important. It is, I think, well known by now to a lot of people that 1 in 5 children are impacted by mental health issues. So this is quite prevalent. And this is based on international studies, but we do have studies from the UAE that also point to similar figures, basically.
Yeah.
So the extent of mental health is quite profound, and the impact, mental health,
Yeah.
mental disorders are considered more like a hidden disability, basically, because
Yeah.
it's not very clear that this person suffers from mental health
Especially
problem, or
among
the child.
children, I believe.
Absolutely,
Yes.
absolutely.
Sometimes they think they're just growing pains, or it's
Yeah.
a phase the child is going through.
Yeah.
Yeah.
And sometimes the child is internally suffering and struggling, and this
Yeah.
impacts school functioning, impacts social relationships, whether it's within the family or with friends and peers. It impacts actually the child while the child is developing. So
Yeah.
mental disorders can actually impact the trajectory of how the child develops in different domains. And identifying and treating mental disorders can also have a profound positive impact on putting the child on a positive trajectory developmentally.
Yeah. That's definitely the I think maybe the priority of every parent. Have you led research or been involved in research that relates to this topic?
We have many projects within mental health. Some of our projects are, a lot of our projects, given that our research is conducted within the hospital, it's clinical research. So I'll give you 2 or 3 examples quickly.
Yes, please.
So one example is that when we started actually working within this field, we encountered many kids with attention deficit hyperactivity disorder, ADHD. It's a quite
Yes.
prevalent disorder. The prevalence ranges between 5 to 10% of school-age children. And there is no way that one hospital can cater to all the clinical needs
Yes.
of these children. There's no way if you just project the numbers on the prevalence on the local population of Dubai. So we actually conducted a randomized controlled trial of an innovative collaborative care model, whereby we trained 4 or 5 physicians within primary care sector in Dubai. In primary health clinics, it was a collaboration between Algeria Children's and DHA.
Yes.
And these physicians were able to start ADHD clinics within primary care center.
Wow.
And in fact, we're about to publish the preliminary findings from this study that shows that the care that they were able to provide in collaboration with experts from Algeria Children's
Yes.
was actually comparable in terms of clinical outcomes to care provided by an expert in the field,
That's
which is really wonderful. It's approachable, easily accessible by families,
Yes.
less stigmatizing, as well as clinically
Less
meaningful.
costly. Yeah.
Absolutely.
Uses existing capacities rather than keeping on increasing, which is not feasible, like you said.
Absolutely.
Wonderful. So that's one example. Can you give us another one?
Yeah, another example. So one of the active areas where we're conducting a lot of research is autism spectrum disorder. And in fact, our autism program, I could maybe say that it started.
You are one of our leading researchers in autism spectrum disorder in the DHCC actually right now.
So I had the privilege actually of working with a great team, and we received an award from a research grant from Algeria Foundation.
Yes.
That was several years ago, and this grant helped us actually develop the clinical program based on research standards. So the merge between the clinical service
Yes.
and the research standards
Yes.
was actually really great, even for patients. They
Yes.
really liked the comprehensiveness of the care that was provided
Of
through
course.
this multidisciplinary, state-of-the-art approach.
Yes.
So it immediately translated to better care for patients.
Yes.
That's number one. Number two, it allowed us to basically develop a cohort of patients, of children with ASD from the UAE. And on top of the clinical study looking at outcomes of children with ASD in the UAE,
Yes.
we were able to plug in collaboration again with colleagues from MBRU and other universities, such as Harvard University, Sick Kids Hospital in Toronto, and other programs, and definitely the Genomics Center at Algeria Children's. We were able to analyze genetic data of these patients to identify unique genetic mutations within the UAE population that could be correlated with autism spectrum
And
disorder.
can you tell us, was there any association?
We published a paper so far, and we have a large data set. We're in the process of analyzing, and inshallah be available soon.
I can only imagine how gratifying it is to be dealing with children and helping them, and just improving the lives of these families. So it is a very important discipline. How can we encourage young professionals to get into mental health research more and more?
Yes, that's a great question, and I think it should start very early on, probably from from homes, from
Yeah.
parents, encouraging the natural curiosity that all kids are born with. Basically,
Yes.
how, what, why. We should encourage this question
I
rather
love
than.
that you said that. I had Miss Ruth Burke, who's the principal of the Swiss International Scientific
Yeah.
School, and she was talking along those exact same lines
Yeah.
about not suppressing the, even though the whys from the especially 5-year-old, 6-year-olds might be annoying sometimes. We need to encourage that.
Yeah, but these annoying questions are basically the seeds for scientific discoveries
Yes.
in the future
Yes.
and curiosity, and then definitely within school curriculums, as well as within medical schools. So I'm also privileged to be working with Mohammed bin Rashid University as an assistant professor, and we're involved in teaching students. Research is embedded within the curriculum,
Yes.
which is very helpful.
Yes.
And we were very also careful to include research within the Child and Adolescent Psychiatry Fellowship Program. So I think we need a lot of research, and the more we have in terms of expertise in clinical research, the better we will be able to produce in terms of important research findings.
Yes, sounds amazing. So you are quite research active yourself, like previously mentioned. Do you have tips for aspiring researchers on where to begin, what to read maybe?
Yeah, I think connecting it with the previous question, it is important to have internal passion.
Yes.
Research can be tough actually. So there are exciting moments in research, but if the focus was just on the publications and on getting a grant, the moments of gratification would be very few
Yeah.
through the life of a researcher. But the natural curiosity, loving and enjoying every single moment and every single challenge. Research can be a tough journey, especially if you start from with limited infrastructure.
Yes.
You're fighting against the system. You're trying to develop a system, but eventually it's going to be gratifying. So I think enjoying every moment, trying to approach every moment with curiosity, understanding it. So a lot of our side projects came from obstacles that faced us. Just to give you an example, in this ADHD study, we faced the issue of low referral rates to the research clinic, which was very puzzling because we thought that we'll be flooded with referrals based on the
Yes.
prevalence of ADHD.
Yeah.
But this led us to conduct a qualitative study to understand what are the reasons behind this. So what
Maybe
are
there
the
are barriers you were not
exactly among
aware
parents
of
and physicians basically.
Uh-huh.
And this study perhaps might have been even more important than the original study that we were conducting.
I tend to agree. I think so. Enjoy each moment. I think that's advice for anything in life.
Yeah.
Very good advice. Thank you. You've presented at conferences, symposia. What do you think conferences? How do they help researchers? What role do they play?
Yeah, I think conferences are extremely important in terms of bringing researchers from all over the world. I mean, virtual conferences are great. I love them, but we all look forward to have
I don't love them.
in-person conferences. They do have some advantages, but the conferences are social meetings basically. They are
Yes.
So the social aspect of scientific meetings are meetings, so between people. So it's really important. So bringing in researchers, learning about the best practices, developing networks, and talking about conferences. We were privileged actually to win the bid to host the largest conference in child and adolescent mental health. It's the World Congress of the International Association of Child and
Wow.
Adolescent Psychiatrists and Allied Professionals, that has been running since 1937.
Wow.
Never took place in any Arab country before. So it'll take place in Dubai in 2022, actually in this very place in March.
Exciting. You heard it here first.
Yes. So we really encourage local researchers to look up the website iacapap2022.com, pre-register for the conference and stay tuned. And talking about research, we do have a pre-conference intensive training program for young researchers that's going to take place in October.
Wonderful. And where can people who are interested find this information?
Yeah, the best way is to visit www.iacapap2022.com. This is IACAPAP2022.com.
Awesome. Thank you so much. So, and that will definitely foster more local, regional, international collaborations, hopefully.
Absolutely. And you love the theme is actually child and adolescent mental health,
Yes.
shaping the future. So
Yes.
it's really about how can we move forward in the context of the current advancements in technology, in genomics, big
how
data.
do you see that future in the UAE over the next decade, doctors?
So I think we're on a healthy trajectory in terms of awareness about mental health, in terms of people seeking services, interest in research.
Do you think COVID maybe contributed to that awareness somehow?
To be honest, this is not based on empirical research, but as a clinician, I would say yes. I tend to agree with you.
It just became part of the normal, conversations people had about the stress people are under, children studying from home, and everything, all the impact that might have had on them. Yes.
Absolutely, I totally agree with you.
Yeah. Dr. Ammar, this has been wonderful. Thank you so much for joining us today. Would you like to add anything before we close?
Thank you. I just wanted to thank you for the opportunity, and I wish everyone, enjoyable time during Arab Health.
Definitely. Thank you so much. Thank you for joining us throughout these 4 days. As we say in Arabic, ختامها مسك with Dr. Ammar Al-Banna. Looking forward to seeing you again maybe next year. Bye-bye.
Thank you.